Is gluten throwing you for a loop, but your doctor says celiac isn't to blame? Well, there's a popular diagnosis called gluten sensitivity that might prove to be the perfect middle ground. I'm Kimberly Walston with a Spotlight Focus here on Insiders Health News. Let's kick off this story with the basics. Gluten is a protein composite found in foods processed from wheat and other grains, breads, cereals, the like. Now that you know the offenders, you might be one of the many people who blame the substance for their tummy troubles. What was once nothing more than a fringe disease is now accommodated in most restaurants and corner markets across the country. But many think they're looking at a choice between full-blown gluten rejection or total tolerance, when your condition might actually be somewhere in between. Celiac disease is no joke, a genetic condition that damages the lining of the small intestine and is attributed to an autoimmune reaction to eating gluten. It leaves a higher risk for anemia, osteoporosis, and gastrointestinal cancers, and can be discovered through specific blood and bowel tests. Gluten sensitivity, however, is a whole different battle. There's no easy diagnosis, no serious side effects, and it doesn't come with the same genetic markers as celiac disease. Symptoms are some mild variation of the disease, including diarrhea, abdominal pain, general irritability, uncomfortable enough to make people take things into their own hands, switching their buying habits to gluten-free. While it's a proactive step, it's also one that has doctors scrambling for accurate diagnostics. The important thing is to realize that there's a whole spectrum being discovered. So just because you don't get a clinical verdict doesn't mean you're not being harmed by the protein. So if you've had any problems with IBS, food-related headaches, fogginess, fatigue, consider the possibility of a gluten sensitivity. Talk to your doctor about thinking outside the box rather than relying on tests. And above all, listen to your own body. If you have a hunch that your issues could be gluten-related, cut this stuff out of your diet for a month and see what kind of personal changes you're able to achieve. If it works, you're in great shape. And if it doesn't, it could be a sign of something more serious that needs to be looked at. As always, we remind you that it's your health. I'm Kimberly Walston. Stay well.